Our nation's most recent Surgeon General, Dr. Vivek Murthy, has reported that drinking alcoholic beverages is a leading cause of cancer in the U.S., which goes against past reporting that alcohol could be even good for you. To discuss it, we are joined by our medical expert, Dr. David Winter of Baylor Scott & White. Good morning, Dr. Winter. Well, let's get into this.
Good morning, Mark. Good to be with you.
Oh, glad to have you as always. What does the medical science tell us about alcohol and our health?
Yeah, it's a little bit confusing, Mark. Previous studies did show that drinking was good for you, but here's the criticism. They took a group of folks that drank alcohol regularly and folks that didn't drink. Well, some of the folks, at least in the didn't drink category, had reasons they couldn't. They had some medical illness, or they've been bad alcoholics and quit drinking. So taking those out kind of mixes up the information a little bit. Now, there's no question that heavy alcohol drinking is bad for you. It causes liver failure, brain damage, and lots of cancer. So heavy drinking clearly is not good for you.
Anecdotally, I think we hear stories about people in parts of the world where it's very common to drink. You hear about the Mediterranean diet. You hear about people in Japan who drink every day and, have these long lifestyles. But let's talk about specific links. Any cancers that we know of linked to alcohol consumption?
Yeah, lots of cancers, most of them in the GI tract, gastrointestinal tract. I've got my buddy here to show you. Head and neck cancers increase when people drink a lot. Throat cancer, esophageal cancer, your swallowing tube, stomach cancer, colon cancer, and then in women, breast cancer. So lots of cancers. Now, it's not all alcohol that causes those cancers, but that's a factor in these we've at least identified so far.
Let's talk about factors as well when it comes to alcohol and heart disease, because I spoke about that anecdotal reference earlier. You hear the French talk about a glass of red wine a day, good for your heart, maybe not.
Yeah, we call it the French paradox. It's not really clear. Supposedly French people, or at least most of them, eat high-fat, high-cholesterol foods. A fair number of them smoke, and they love their red wine. They say it's an anti-inflammatory drug. Well, it has some anti-inflammatory properties, but other properties also that may counteract that. So we don't really know if the French, what's going on with them. Maybe they're genetically privileged and alcohol helps them. We don't actually know the answer there. I'm not sure it applies to Americans.
Well, for those of us who are stuck here in the U.S., would you recommend, based on this new research, that people drink in moderation, or do they cut out alcohol altogether?
I think more studies are needed, but right now, if you're not drinking and you're fine with that, I wouldn't encourage people to drink. There's no clear evidence that it's going to make you significantly healthier. No question, heavy drinking is not good. Moderation in drinking is probably okay, we think. Now, the change in moderation, though, moderation is moderation, but it used to be 3 drinks a day for men, 1.5 to 2 drinks for women. Some are saying that should be lower. So we're redefining what moderation is right now, and probably not every day. Give your body a day or two at least during the week where you don't drink. So more studies to come, but right now we're kind of worried about too much drinking, and maybe heavy moderation, mild moderation probably is better.
So it sounds like cheers, maybe.
Half cheers.
Yeah, half cheers. All right, Dr. Winter, as always, a pleasure chatting with you. Thank you for joining us today.
Good to be with you, Mark. Thank you.
Yeah.